Orlando Health is a system of 9 hospitals, a little over 2,000 beds, and we service the whole region of Central Florida. We're looking for ways that we can improve healthcare. And it's not just about technology, it might be about the relationship we have with a physician practice. They have the same goals we do. They want to provide high quality stroke care, and they want to reduce the amount of time it takes for them to make a good decision about what the patient needs.
Someone comes into our emergency department and they have the symptoms of a stroke. Brain tissue dies without oxygen and blood flow. You need to make contact with that neurologist very quickly.
The physician could be at home, the physician could be in their clinic, and we want to be able to provide fast access to their patients that are in need of time-urgent stroke care.
The more rapidly you treat a patient for stroke, the more likely you are to have a positive benefit.
We have neurologists on call to take stroke calls hooked up through the Polycom system so that we have a direct video feed from the patient's bedside to the neurologist.
I want you to hold your arms, palms up like this.
That's good. And take your left hand and touch your nose.
Treating strokes in the acute phase requires a tremendous amount of expertise, but neurologists typically are not in-house 24 hours a day. Having the ability for the neurologist to interview a patient in real time decreases the time to treatment.
It's very important to, first of all, get an overall view of the patient, a wide-angle view, if you will, and then to be able to zoom in on certain features of the patient. It allows me to evaluate for neurologic symptoms such as pupil size, asymmetry. The controls on the tablet are very intuitive, they're very easy to use, and the ability to remotely operate the video control is extremely important in that assessment.
RealPresence Mobile is important to us because it gives us the technology in the hands of the practitioner. So they're portable, they're mobile, they can go from place to place and still be able to respond quickly enough so that we can provide the quality of service and the access of service in even some of our smaller hospitals.
Anything that makes our life as a physician easier is, of course, something that we cherish, and the ability to have some freedom to not have to be in-house, in the hospital 24 hours a day, to have a life outside, and yet to be able to deliver excellent care to patients when they need it is very rewarding.
Orlando Health is the first medical organization to be able to access the far-end camera control functionality from a tablet device to a standards-based video conferencing system. That offers us the ability to make better decisions about patients, have better control of the far-end environment, and ultimately deliver better outcomes.